If you suffer from neuropathy, there's a new medical breakthrough treatment for neuropathy patients. If you've had this problem for some time, this is an opportunity for you to get better and to actually find out how you can get relief for the first time with many of our patients. This is an FDA cleared program. It is paid for by Medicare and most major insurance companies. You can find about our treatment at azneuropathy.com or neuropathyca.com. This is a brand new medical breakthrough treatment. The study that was done found an 87% reduction in symptoms. It's a proven clinical study that showed patients who got the treatment no longer had pain, numbness, tingling, burning in their feet, and were considerably better. Follow-up results showed ongoing relief 1 year later. In addition to that, the patients found that they were able to have improved function and able to do more things, which we'll talk about later in this video. Again, more information at azneuropathy.com or neuropathyca.com. Here's a patient who had his problem. He had pain and the difficulties of neuropathy following diabetes, and he said that he had a 90% improvement following the treatment. This treatment's available in Northern California and Phoenix, Arizona. You can find more out about it on our website, azneuropathy or neuropathyca.com. So what is this treatment? The treatment is done in a lounge chair by our medical staff. It is not oral medications, it's not a chiropractic office or treatment, and it's not a laser treatment, light treatment, or anodyne therapy that some of you may have had. It's not surgery or painful to the patients, and it is done on an outpatient basis. You come in, you go out, you're seen a couple times a week, and it's direct treatment to the legs based on the clinical study using the protocol, which found an average reduction of 87% in pain and symptoms. So again, if you've had neuropathy and you've been treated with maybe systemic oral medications, which it made you felt a little bit in a medical fog or from the medicines kind of out of it, we don't use any medicines, and in fact, many of our patients no longer need to use their medicines as a result of this treatment. This particular woman, who can be found on our website, said, quote, "It's like a miracle has happened." She had neuropathy and she had pain in her legs, into her knees, and of course in her feet. And she said, quote, "So I started coming to the neuropathy clinic here, and it's like a miracle has happened." And she goes on to say essentially that her symptoms were reduced significantly. And this is common. We commonly see patients who've been other places, done other things, and find that they have a significant reduction in their pain and symptoms. We treat neuropathy from diabetes or diabetic complications. We treat neuropathy as a result of long-term medicational use, such as cholesterol or some blood pressure medications, which can lead to neuropathy. And we also treat patients who have circulatory problems, chemotherapy-induced neuropathies, or autoimmune-induced neuropathies like rheumatoid arthritis, fibromyalgia. Sometimes even spinal stenosis-induced neuropathy does respond to this treatment. But if you've had neuropathy and you haven't been able to find relief, this is a new breakthrough program. It is paid for by Medicare. It is FDA cleared, and we mostly treat patients who have had lower limb, like the feet, but you can also, if you have it in your hands as a result of, say, something like chemotherapy, you can come and see us for that as well. azneuropathy or neuropathyca.com is where you can find us. So what does a typical patient have? They typically have restoration of function for the first time, and many have tried other things. You know, anybody who has neuropathy knows it's a miserable condition. So many of our patients have tried treatments like medications, laser, light therapy, chiropractic, physical therapy, or even pain management treatments. And many of them have increased their pain management, increased their pain medications because their neuropathy gets worse over time. So what we found is that patients who have chronic neuropathy and symptoms, even with some complications, who've had it for years or decades, typically get better. They're able to walk without pain. Many are able to sleep all night for the first time in years. They find they no longer need oral medications. They don't have the burning or prickling or sharp pains in their feet. They have better balance, no more pain, and of course they often can feel their feet again, their shoes fit, they're a lot more comfortable, and frankly they're a lot happier. You know, typically when you have this type of pain and discomfort as neuropathy causes, it can affect your ability to enjoy your family, to produce income, to work, to go out and do things. And so all of these things by getting this reduced or eliminated through this treatment are restored, as you can see by our patients here. There's more testimonials on our website at www.azneuropathy.com. Here's a patient also on that website before, basically miserable. After, quote, I don't have pain anymore. Pins and needles, typical of neuropathy. Really bad in the evening, worse when he got off his feet and tried to go to sleep. Can feel now the bottom of his feet when he walks. Said, quote, he's very pleased with the results. So we'd like you to be pleased with the results. Your first step is to give us a call. If you are a candidate for this treatment, not all are, our medical staff will tell you. So the best thing to do is call our office. The phone numbers are on the website. And let's see if you are a candidate. Our consultations are always free of charge. Medicare does pay for our treatment, as does most major insurance companies, as we mentioned. And if you're traveling some distance or you're from out of state, let us know, and we can let you know of some local hotels that you could stay at during your treatment. Typically, patients are seen anywhere from 2 to 3 times a week, depending on your age, condition, your neuropathy, your diagnosis, your genetics, and overall health, and what the medical providers decide. And of course, not everyone gets results, but certainly we're having very good results with patients who've had chronic neuropathy, and your results may vary and be different than those found on the testimonials. That being said, our goals and yours, I'm sure, is to have happy feet, to feel good again, to be comfortable and to have a happy life, and to not be in pain and to not have that misery, and to be able to sleep at night. So the best thing to do is you can call us direct or go to our website. In Roseville, Northern California, Sacramento area, 916-786-2002. You would fly into the Sacramento Airport, Sacramento, California Airport, if you're going to come from out of town, or in Roseville, California, right off Highway 80 and 65 junction. Typical cities nearby: Roseville, Lincoln, Sacramento. If you're in Phoenix, we are in Surprise, we are in Scottsdale, and we are in Phoenix by St. Joseph's Hospital. 480-459-5992. Again, just go to our website's directions, maps, and information is there. Thank you so much for listening. If you've been suffering from neuropathy and you've had it for a long time, give us a call and come in for a free consultation, and we'll find out if you are a candidate for this treatment. If you are, and most people are, we find that you get very, very good results. Typically, the study found 87% reduction, so that's quite a bit, and that's why we're excited to share this with you. Medicare and most insurances do pay for what we do. Thank you again. 916-786-2002 in Sacramento area, 480-459-5992 in the Phoenix area.